So this is my presentation on physiological and psychological responses to sports injuries. Have fun. Okay, physiological responses. To ensure the treatment is correct, it is important to know the signs and symptoms for all of the different types of injuries. It is important for someone with an injury to go to a specialist or read up on an injury as quick as possible, so the best care can be given for every stage of treatment. Physiological responses can be defined as the body's mechanisms to help the body to recover from an injury. These are put in place in order to protect and repair the damaged tissue. Damaged tissue inflammation. The body responds in a number of different ways as soon as an injury takes place. Any damage to a body tissue initiates the first mechanism of the body's response. The main two signs and symptoms of this is for there to be pain and inflammation in the area of concern. A symptom is a phenomenon that is experienced by the individual affected by the, let's say, disease, while a sign is a phenomenon that can be detected by someone other than the individual affected by the disease. Inflammation comes from a repeated load, friction and pressure on a joint or muscle. This is associated to a lot of sports injuries, such as a sprained wrist from a rugby maul. There are more signs and symptoms that align with inflammation, such as increased amount of fluid that surround the injury, a clear colour range of the skin to red, colour change due to an increase in blood flow, tender to touch, and also a reduced range of motion. Next is bleeding. When there is an open wound from injury, bleeding will start. This is to start the healing process, as the blood will then clot. An open wound could occur in football from a studs-up tackle, which can pierce the skin. Platelets, a small colourless disc-shaped cell fragment without a nucleus found in large numbers in blood, are there to make the blood clot by sticking to the surface of the blood vessel. These are alerted by chemical reactions due to trauma in the body. Fibrin is formed within the blood clot. This makes the site more stable. This is then replaced by collagen fibers that replace the damaged tissue. The amount of bleeding that occurs is specific to the severity of an injury. There are two types of hematoma, which is localized bleeding outside the vessel: intermuscular and intramuscular. Intermuscular hematoma, this is where the bleeding only occurs within the compartment of the muscle but doesn't seep into the tissue that surrounds it. Intramuscular hematoma, this is where the blood escapes into the surrounding tissues. Scar tissue in the remodeling stage. The remodeling process is known as the procedure to restoring a tissue to as close to the original state at the site of the injury. Straight after the injury, scar tissue starts to form by laying down a protein called collagen. This is a fibrous tissue as a replacement to the normal skin. This is not, however, as elastic and pliable as normal skin, making it less effective and efficient at doing its job. The more serious the injury, the more difficult it will be to restore a damaged tissue to the original state. This is made harder if the wrong treatments are given to the body part. An example of where different treatments would be given would be a first, second and third degree sprain, making it important for the athlete and doctor to identify the right symptoms and signs to then make sure the right diagnosis is made. A first degree sprain is the stretching of the ligament. On the other hand, a third degree sprain is complete tear or detachment of the ligament to the bone. A sprain, as just mentioned, is a damaged core caused to a ligament from a stretch or a tear. The causes of this are normally from a quick twist, impact, or fall. A sporting example of this is when trying to possibly tackle an opponent in rugby, and twisting motions can occur when trying to change direction quickly. Okay, psychological responses. On top of the physiological responses that the body takes, psychologically the athlete may struggle to cope with an injury setback. It can be defined as the mental aspect of how an athlete copes and comes to terms with the injury and treatment. The way a body responds depends on an individual and the type of injury sustained. It is a very serious issue, as psychological response to injury can trigger or unmask mental health issues, including depression and suicidal thoughts, anxiety, disordered eating, and substance use. In the following slides, some of these psychological responses are examined and explained. Okay, so one of the psychological responses would be fear. This can come from the belief that you may not get back to full fitness, and also reoccurrence of an injury. These thoughts could be experienced at the moment by Andre Gomez, who recently, after a leg break, has just ruled him out of for the rest of the season. Stress and anxiety. This can be felt during a competition or match. If an injury occurs, then anxiety and stress will increase. This could be to the point where the injury could put their short and long-term prospects in the sport at jeopardy. Motivational issues. Due to the length of rehabilitation, some of the injuries, like a ruptured Achilles, an athlete may lose motivation due to falling out of love for the sport, due to the injury duration on the sideline. Depression. Symptoms of this is natural for an athlete to experience within injury. Low energy levels, decreased social contact, and constant sadness. Anger. This can be towards the injury, people around themselves, and the person who possibly influenced the injury upon them. This would be most prevalent post-injury, as you may feel aggrieved at the situation you or they are in. If these types of psychological experience were ignored by both the player and the people around them, then they could be prone to having severe mental health problems, as suggested on the previous stage. This could be detrimental to their career. An option to stop this would be to appoint a psychologist for during rehabilitation and when they are getting back to full fitness. This would be able to make them overcome the responses. Further responses to that would be a decrease in confidence. This is normal for them to experience this, especially if they return to sports. It may take a few games to gain confidence back. An example of that would be Alex Oxlade-Chamberlain, who's had many different injuries recently, and recently scored his first England goal in a long time. Denial in an attempt to get back training quicker. By the way, Alex Oxlade-Chamberlain last year ruptured his ACL in the Champions League semi-final, and it's only just come back. So yeah, there's my example that I just thought of in my head. Sorry, denial. In an attempt to get back training quicker, player may downplay how they are feeling and try to get back playing quicker than scheduled. This can lead to further injury. It is important for the coaches and physios to communicate to make sure they go through the rehabilitation stage fully. An example of this could be Eric Bailly, who constantly seems to be on the sidelines. This could be due to possible denial of how he's feeling and reoccurrence of an injury. Frustration. This is the most common response for all athletes who want to play, as they will crave to play the sport and become frustrated by a lack of physical activity. A good example of this would be Tiger Woods, who missed competition after multiple injuries, operations and personal problems left him without a swing, and then later went on to win the Masters earlier this year, which was very good. Isolation from teammates. In a team sport, an individual can become mentally withdrawn from a team due to a lack of interaction with his teammates in training and in match scenarios, leading to greater amounts of frustration. In 2010, Aaron Ramsey, who's playing for Wales tonight, suffered a fractured tibia and fibula in his right leg, which required surgery and one of the most grueling physio and rehab periods anyone could go through. This would have made him go through every single one of the emotions listed or spoke about, to the point he never thought he would play again. He was quoted, he thought he would never play again. He is now playing for Italian giants Juventus and earning a small £400,000 a week. Not too bad, is it? Responses to rehabilitation. Rehabilitation is a recovery from an injury in the most effective fashion to return to as normal state as possible, while reducing the chance of injury in the future. Responses to this can either hinder or assist healing. These are anxiety. This occurs at all stages of the injury process due to the uncertainty around some treatments and methods that are used. Also frustration. This is down to the fact they may not see the immediate improvements in the program they are doing, or there is a reduced amount of progress towards the end goal. Need for motivation. Athletes will need to stay motivated due to the length of time on the sidelines. The people around them can help with the use of goal setting, which can be used also to keep track of an injury and see the improvements. A current example of this would be Paul Pogba's goal, which is made public, which is to be fully fit and playing within the next couple of weeks after being 2 months out. Now going on to my videos. They are on my YouTube channel, which this video obviously will be on, so you probably have already seen this possibly, but a bit more on those injuries. Firstly, a dislocated shoulder. A dislocation occurs when the alignment of bones become disjointed. The type of injury can occur from impact with an object, an opposing player, or sudden fall. Places that dislocations can occur are the knee, ankle, elbow, shoulder, hip, finger and toe joints, so quite a lot. From a dislocation, ligament damage can occur as they become stretched and sometimes permanently. If they are permanently stretched, this can lead to the injury occurring again. This means it is crucial to get medial attention to make sure the bones are replaced in a correct alignment and minimise the damage to the joints. Onto the sprained wrist. The causes of the sprain are generally a sudden twist, fall or impact that makes the joint move outside its normal range of motion. Sprains can occur at the ankle, wrist, thumb or knee joints. The severity of the sprain depends on the degree at which the ligaments have been affected and how many have been damaged. The severity is regarding whether the ligament has been stretched or torn. These are all categorized as previously explained. A wound, also known as a puncture wound. This type of injury can lead to a lot of bleeding, so it is very important to prevent infection for the person treating the wound and obviously the casualty. Further priorities when treating the wound are to stop blood loss and prevent them going into a shock. To treat the bleeding, there should also be direct pressure needed to be applied to the site of the bleeding using a bandage, just like in the video. The correct treatment for any injury is important to ensure the healing process can occur smoothly. If in any doubt, a professional should be contacted. Finally, a broken knuckle. This is finally for the YouTube videos. Anyway, I haven't quite done. This is a common hard tissue injury. It can happen to all bones in the body. Regarding broken bones, and from many different scenarios, such as boxing from the video. A broken bone is the same to a fracture in some respects. Most are due to direct impact, but the site of the injury and how it happens will leave different broken bones or fractures, such as an open and closed fracture. This has been diagnosed so that different treatments can be given for everyone. Common treatments in this scenario, soul taps. When assessing an injury, it is likely that you had seen the injury, so you have a good understanding as to which body part that will need to be looked at. A technique in doing this would be soul taps. In the best interest of diagnosing the patient, the following guidelines are used at the point of occurrence. The aim of this is to make an accurate assessment of the type, severity and the location of the injury, which has been touched on how important that is earlier in the I was going to say lecture there, but you get the lectures. Firstly, the first of the acronym is STOP. This is to look at the injury to start with. Next would be ASK. Question the athletes on the injury, how they are feeling. Example of this, how painful is it? Look. Obviously you need to observe for any symptoms, like, well, obviously not symptoms, but see if there's any signs such as swelling or a colour change. Touch, feel the injured area to see where there is swelling and you can ask what areas are the painful areas. Active movement, can the athlete move the injured part of the body? Passive movement, if they can actively move the area gently, and you can gently put it in a full range of motion. And lastly, that will be a strength test. Can a player put pressure on the injury? And to the next level of that, can they actually play on through the injury? And if that's the case, you need to make sure you keep an eye on them throughout for the rest of the match or whatever scenario they're playing in. The other common treatment would be priced. This is for less severe injuries. The first a time to use it would be when a soft tissue becomes inflamed, and you would go through the procedure to reduce the swelling and pain in that area. Firstly, you need to protect the person and injured area to stop further injury. Secondly, rest allows the body to heal. Third, you need to apply some ice. This is to stop the swelling. Then compression acts as support and prevents swelling. Elevation then reduces blood flow, which in turn also reduces swelling. And finally, diagnosis by a professional to then go on to further treatment to make sure the rehabilitation stage happens effectively. Okay, and then it goes on to references. And thank you for watching. And the YouTube video will be up hopefully before submission.